Exactly 1 month after President Trump declared a national emergency, all 50 states are under a major disaster declaration. That is a first in U.S. history. And as has been the case for weeks, hospitals nationwide are still struggling to manage the high volume of COVID-19 patients in need of help. Let us bring in CBS News Chief Washington Correspondent Major Garrett. Major, good to see you. So the president tweeted. So a couple of things about the president's Twitter account this past weekend, Major. He spent a lot of it either retweeting congratulatory tweets to himself or taking on reporters, the New York Times specifically. He had some derogatory things to say about Chris Wallace, the son of Mike Wallace. And the tweet that the president, I think, made a lot of people take a step back was, he tweeted, for the first time in history, there's a fully signed presidential disaster declaration for all 50 states. We are winning and will win. It's almost as if he's congratulating himself for the fact that all 50 states, for the first time in American history, are under a declaration of disaster. So help us understand, if you can, what the president's strategy seems to be here. Is this just a way to continue to shore up his base as he prepares to mount his reelection defense?
Well, one of the elements of this disaster declaration proclamation from the president for the first time in American history, okay, this is a historic presidency. And presidents signed those orders at the request of governors to provide maximum federal assistance to the states. So the president is saying, I'm doing that. I'm providing maximum federal assistance to states who have requested it, and all 50 states have requested it, and I've agreed to every one of those requests. Okay, that means in terms of exercising presidential power, you're doing it at historically high volumes. Okay, all true. But had you better prepared the country and your administration, would we be going through this? There's a growing body of evidence that if different decisions had been made by this president and his team in late January and throughout the month of February, perhaps there wouldn't be the kind of disaster or the kind of massive sickness and death and economic dislocation the country is seeing. And that's some of what the president criticized over the weekend. There was an extensive and deeply reported story in the New York Times a week after there was one of a similar vein in the Washington Post, recounting either memorandum presented to the president, conversations the president had late January and early February, where the president downplayed not only publicly but internally the lethality and the widespread contagion that could be COVID-19. And those decisions, which left in their wake a lack of mobilization at the federal government level, has intensified, by anyone's estimate, what actually happened. It's not to say the president did not take some significant moves, he did. But those moves were often individualized and not accompanied by government-wide action on testing, on obtaining and deploying personal protective equipment, on preparing the country for the kind of economic dislocation it might have to endure in order to stop the spread of COVID-19. All those other decisions were held in abeyance until mid-March. And as we have learned, to our great regret, those lost weeks increased infections and increased death tolls and increased economic dislocation. That is not a narrative. That's just a fact pattern. And what the president is trying to do is find those who he can argue with. But as we've discussed here before, COVID-19 doesn't argue back. It just spreads.
Major, according to the reporting that you pointed out over the weekend and the week before, among the loudest voices in the room warning about the impact of the coronavirus was President Trump's top trade advisor, Peter Navarro. Now, according to the reporting, he warned that millions of Americans could die, and he did that in January. He is now the policy coordinator for the Defense Production Act, and he spoke to 60 Minutes about the lack of enough and adequate personal protective equipment for healthcare workers. I want to play a little bit of that 60 Minutes interview. We'll talk on the other side.
Wouldn't be having this problem if we had the domestic production of essential medicines, medical countermeasures, medical supplies like masks, and medical equipment like ventilators. If we made it here, we wouldn't be faced with this. That was the original sin.
All right, so all things sort of deserve context. So give us a sense of, how we should understand Mr. Navarro's comments and just how the Trump administration is using the Defense Production Act to remedy the problem.
All right, back to the original point that Peter Navarro is making, which is a much deeper one than how the administration reacted in a time of crisis. He's making a long-held economic argument that collectively the United States essentially moved much of its production capability for lots of things to China. Why? Because the labor was so much cheaper, regulations less intrusive, environmental labor and otherwise, and you could have profitability in the United States by essentially exporting your production to China. That is an economic argument that China hawks like Peter Navarro have been making for a very long time. It's why they argue there is a great trade imbalance between China and the United States. And it's one of the things that the president has talked about throughout his administration, why he waged the trade war against China, so on and so forth. And look, in the atmosphere of COVID-19, lots of companies who did that, essentially exported their production to China, have reevaluated that and said, you know what? This is maybe a bad business decision. Maybe we want to have production closer to us, less susceptible to things like a coronavirus that emanated from China originally, bring it closer. So it's not as if this is an outlandish economic argument. But why was Peter Navarro's message not heeded? You said he might have been the loudest voice in the room, but he wasn't the one who was heard the most clearly. Peter Navarro is known, A, for writing lots of memos. The president himself said at the podium last week, Peter writes a lot of memos. Okay, that gives you a reputation within the West Wing. You're a big memo writer. Does that mean everyone heeds them or listens to them or takes every one of them with requisite seriousness? Clearly not in this case. The president thought those, like Peter Navarro, Alex Azar, Secretary of Health and Human Services, and others who in late January and early February were trying to raise attention about COVID-19 were, quote unquote, alarmist. And when you're in that camp, the president has to see other things before he's going to change his mind. And he didn't see other things until well into early March. So Peter Navarro has a memo. The president last week said at the podium he hadn't seen it. The New York Times reported over the weekend, in fact, he had. How much he paid attention to it and how much he absorbed its dire warnings, he would say, well, I implemented travel restrictions against tourists and others coming from China, announced on January 31st, put fully in place February 2nd. That was an important move, but it wasn't followed up by any of the other things we were just talking about. And that's the big gap for this administration. One travel restriction is not nearly enough, didn't prove nearly effective enough, and lots of other decisions that could have been made that would have reinforced the instinct behind the travel restrictions in China, meaning this is a big deal, it's going to get bigger. Those decisions were not made, the preparations were not there, and we are where we are.
And so, Major, let's talk about now the response subsequent to that. I want to draw our viewers' attention to a Washington Post editorial that came out last week by Joshua Geltzer, who is a former Justice Department and National Security Council lawyer. And he writes this, he calls this, what we're seeing from the president and his administration in response to the coronavirus, Corona federalism. And this is what how he describes it. Quote, all three of its key features run counter to key traditions of the U.S. political system. Corona federalism involves blaming the states for the federal government's failures, playing favorites among states when it comes to spending federal resources, and indulging states that privilege their own citizens over those of other states to the point of excluding the latter. It's an unprecedented vision of federalism that's rotten to the core, and it's costing American lives with each passing day. And the evidence that he uses, Major, to point to this is the fact that there are certain states with governors that are very closely aligned to President Trump, like Florida and Oklahoma, Arizona, who have gotten every single thing that they've asked for from the federal government, and states that are openly critical to President Trump, whether they be Illinois, Maine, Massachusetts, and New York, which has the largest number of cases, has to walk a very fine line when describing the president's actions and reactions to the press, or the Governor Andrew Cuomo. So how do you see it? Is this really happening, what this former Justice Department lawyer is describing?
Well, I will go back to my conversation last week for the show, one of my two shows, the Takeout Podcast. It was an hour-long conversation with Craig Fugate, who was the head of Federal Emergency Management Agency under President Obama for the entire Obama administration. And in that conversation, he walked through a lot of the strengths of the federal government and the strengths that states possess. But he also said, look, usually in emergency management, there is a location where the problem exists, whether it's a hurricane, wildfires, an earthquake, there is a location-specific problem. And the federal government rushes resources to that specific location to address those specific needs. Even with something like Katrina, it was essentially 6 states. It wasn't all 50 states all worrying about something at the same time, and all with varying levels of intensity. Now, let's just be candid with ourselves. Oklahoma and Arizona comparatively have had fewer requests because they've had fewer cases, so their needs are much more easily met. Florida may or may not be in that condition, but we don't know what's going to happen in Florida. But the president has been incredibly deferential to Ron DeSantis, the governor there, a close political ally of his, although it is clear the president has, via phone persuasion, moved Governor DeSantis toward positions he was not publicly taking. For example, allowing the 2 cruise ships to dock and have their passengers let off and safely transported and treated and quarantined. Publicly, the governor of Florida was not saying that. Then there was a couple of conversations, then things changed. So I'm not exactly sure if there is a new COVID-19 federalism employed by the president. Craig Fugate didn't believe so. He is under the impression, and he did not necessarily defend the Trump administration, but said there are many things when you're in the middle of a crisis, a 50-state crisis, in which the states do have responsibilities and equities that they have to take care of first. But he did say, and this gets back to your question a moment ago, that the president should have been much more aggressive about the Defense Production Act and putting things available to states so they didn't have to compete against one another and they did not have to bid against one another for required medical gear or other elements that they needed to respond to COVID-19 in their states. And I wouldn't say that there's necessarily a COVID-19 new federalism in which the federal government is redefining the constitutional relationship between Washington and the states. What I see happening that I think is far more interesting is states regionally are creating compacts themselves to cooperate with one another, obtain supplies, and reinforce their own emergency preparedness. You're seeing that in California, Oregon, and Washington. You're seeing that in the Northeast, New York, Connecticut, New Jersey, and others. States are talking among themselves saying, you know what? In a pandemic, the federal government is not going to help us. We need to more regionally integrate, cooperate, and plan for our own futures. That is something states can do. They can do it under federalism, and that seems to me to be the far more interesting development. States looking at this administration and the federal government response overall are saying, you know what? In times like this, we cannot rely on the federal government solely to meet our needs. We should plan better, integrate better, and cooperate better regionally. That way we can protect ourselves. That seems to me to be a much more interesting dynamic in reaction to this whole question about what the federal government can or can't do.
Yeah, that is really interesting, Major, and it certainly is a little bit of what the president has suggested from time to time when he, blames the states for not being prepared. So maybe they're taking his advice in some sort of a way. Major Garrett, thank you so much.